The broadcast is now starting. All attendees are in listen-only mode.
Hello and happy 2022, everyone. My name is Krista Brown, Training Specialist with the APS Technical Assistance Resource Center, or the APS TARC, and I want to welcome you to our webinar, Building Partnerships with the Social Security Administration, with Lydia Chévere, Public Affairs Specialist with the Social Security Administration, and Cathy Bahadur, APS Section Manager, Division of Aging Services, Georgia Department of Human Services. And I'll be formally introducing both Lydia and Cathy in a moment, but next slide. Before we get started, I'd like to share a little bit of information. This webinar is being hosted by the APS TARC, which is a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, and administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the federal government. Next slide. The APS TARC works with states to enhance the effectiveness of APS programs by working with partners on use of data and analytics, applying research and evaluation to practice, and encouraging the use of innovative practices and strategies. We're here to help APS programs in any way we can. Just reach out to us using the contact information that will be displayed at the end of the webinar. Next slide. Let's take care of some housekeeping. A handout of today's slides is available for download in the handout section of your webinar control panel, and you may download them at any time. Please use your computer speakers to access audio for this webinar, and the desired speaker volume is up to you. Make sure it's adjusted to your desired volume. If you experience audio problems during the presentation, we highly recommend that you log out and re-enter or log back in. Next slide. We will have time at the end of the presentations for Q&A. At any point in the webinar, you can type your questions into the question box, and we will try to get to as many as possible. This presentation is being recorded, and all registrants will receive an email when the recording is posted online. Everyone today is also able to receive a certificate of attendance, approximately 24 hours with a link to download. And also, please take the post-webinar brief evaluation survey. We really love to hear from you. So next slide. Before I introduce our presenters, just a quick attendee question. What are you hoping to learn from this webinar? So using your question box, go ahead and let us know. And I'm going to go, while you're doing that, I'm going to go ahead and introduce our presenters. Next slide. It is my great pleasure to introduce our presenters today, both very busy people, so thank you for being here. Lydia Chévere has served as a public affairs specialist in Baltimore, Maryland since July 2004. As a public affairs specialist, she is responsible for carrying out public information projects to improve the public's understanding of various Social Security programs. She represents Social Security Administration in events organized by local, regional, and national organizations benefiting individuals at conferences, workshops, seminars, and meetings. Lydia began her career with the Social Security Administration as a claims representative in 1999. We also have Cathy Bahadur, who is a APS section manager with the Division of Aging Services, Georgia Department of Human Services, and Cathy is responsible for all aspects of administrative and programmatic functions in the Adult Protective Services Program. And she has worked in the social services field for over 26 years. So now I'm going to turn it over to Lydia, and Lydia, please take it away. Next slide.
Great, thank you, Cathy. And I also want to thank the APS for inviting us to participate on one of your educational webinars. We appreciate the opportunity to get our information out to people like you who are in the front lines addressing elder abuse and financial exploitation. Like Krista said, my name is Lydia Chévere. I am a public affairs specialist at the Social Security Administration, Office of Communications. Today's presentation is mostly about how to build a partnership or connect with the Social Security Administration. I'm going to start by going over how to contact us during the pandemic, followed by information on how to access our online services safely. And lastly, I will share some tips about how to keep your Social Security number safe. Next. Probably one of the most popular questions right now is how to reach or get help from the Social Security Administration during these times. I am glad to say that we have been able to continue to provide services throughout the pandemic. We offer multiple service delivery options. Most of our services are available online at ssa.gov. You can certainly call us as well at our 1-800-772-1213. All of our offices are providing limited in-person appointments for critical situations only, and that depends on the local office conditions, right? If you are helping someone complete a fraud report or file for benefits, or you're just looking for an answer to a question, an SSA related question, we highly recommend you first go to our website at ssa.gov to see if you can find what you're looking for there first. Most of our services are online, except as you can see on the footnotes, children and survivors benefits can only be done by phone or in the office. Next. If you or the other or anyone that you may be helping cannot use our online services, we recommend you contact your local Social Security office. You can go to ss.gov/locator to locate your nearest Social Security office. Again, that is ssa.gov/locator to locate your nearest Social Security office by zip code. But again, if you don't have access to online services, you could call our 1-800 number and ask them to provide or give you the phone number for your local Social Security office. I can't emphasize enough establishing and maintaining communication with your local Social Security office to resolve local issues, because at the end of the day, any forms, documents that you send to us ends up going to a local field office for processing. And if the field office is not the final destination, they will forward it to the right place. We certainly encourage you to reach out, because we are here to help and we want people to know that we are available, that we're open, and that we are scheduling in-person appointments, but only for critical situations. Next. Now, if your attempt to reach us by phone is unsuccessful, let's say nobody is answering the phone, or maybe they answer the phone but they're not returning your call, under those circumstances, we're recommending that you contact the Social Security Regional Communications Directors. Our Regional Communication Directors are your ombudsman. What you're seeing right now is a web page with the contact information for our Regional Communications Directors. You can go to ssa.gov/agency/RCDS to connect with our Regional Communications Director and Public Affairs Specialist. We have about 120 public affairs specialists throughout the country. These are our boots on the ground. They're the ones who go out every day to educate the public about our programs and services, and they're always looking for opportunities to collaborate with other organizations while educating the public about our programs and services. So again, we encourage you to contact us if you're looking for collaborative opportunities. Next. One of the best way we have for supporting people particularly at-risk populations, is to just make sure they have access to our services and programs. So to help those who may need more help, Social Security launched the People Facing Barriers and People Helping Others campaign. The goal for these two campaigns is to raise awareness about our programs, as well as to help us identify pain points for people we serve, provide a platform for quickly being able to share information, expand our efforts to engage the diverse population, and to create more opportunities for collaboration and problem solving. So what you're seeing right now is our What's New page for groups and organizations. This particular message is to let people know how to get help from us. We included a flyer that third-party organizations can use and share with their networks, so we encourage you to use it. You could subscribe to this page to get updates from us. The link to that page is ssa.gov/third-party/groups/what's new. Now, I know that's hard to remember, but you can just go to our website, select the drop-down menu, and select information for groups and organizations. So it's really easy to find from our homepage. Next. For more information about our People Facing Barriers and People Helping Other campaign, you can go to ssa.gov/third-party, or as I said, you can go to our homepage and look for information for groups and organization. This page was created for those who provide care, caregivers, as well as third-party organizations and community groups. We are currently training third-party organizations and community groups on how to complete or start an application for SSI benefits. So we encourage you to reach out to us if able to help others apply for these benefits. Next. I want to highlight some of our online resources and services and how to access them. Starting with our website, Social Security's website is a valuable resource of information about all of Social Security's program, and is accessible from a computer, a tablet, and a smartphone. Next. The first thing I want to recommend for all of you listening and for those you are helping is to create a My Social Security account. This should be on your to-do list, and that's because basically that's how you will be conducting business with us in the future. My Social Security is a personalized tool that gives you immediate access to your Social Security information, whether you receive benefits or not. Your account gives you the information you need whenever you want it, all without having to call or visit a field office. Now, you cannot create an account for someone else, but you can certainly help someone in doing so. Next. There is a lot that you can do with My Social Security account. If you are already getting benefits, you can opt out from receiving certain notices through the mail if you receive the notices, if the notices are available with a My Social Security account. You can request a Social Security replacement card, and that is true whether you're getting benefits or not. You can report your wages if you're working and receiving SSDI and SSI benefits. You can request a benefit verification letter. You can change your address, update your direct deposit information, and request a replacement 1099 for tax purposes. You can also request a replacement Medicare card. And these are just some of the things that you can do within my Social Security account. As I go through the slides, I'm going to be covering a few other things that are behind the My Social Security, but those are coming next. Okay, next, sorry. Now, if you are not receiving benefits, you can get personalized retirement benefit estimate for both you or your spouse. And again, you can request a replacement Social Security card. You could check the status of your application. And you can also request a benefit verification letter to show that you are not getting Social Security benefits. So it goes both ways. Some people have to show proof that they're getting benefits. Other people have to show proof that they are not getting benefits. You can also verify that your earnings record is correct. And that's really important because Social Security benefits are based on your lifetime earnings. We use your highest 35 years of earnings to calculate the amount of your benefits. So you want to make sure that all of your earnings are posted correctly. Andy, I am going to skip the next two slides, so if you don't mind hitting next twice. Perfect. So to open your account, go to ssa.gov/my account, select create an account, provide answers to some questions so that we can verify your identity, choose your username and password, and let us know if you want to receive your security code via email or text. The next time you visit your account, all you have to do is select sign in and enter your username and password. Now, for additional assistance with opening a My account, you could visit our YouTube channel. We have a 4-minute video that walks you through the process of opening an account. But from what you can see on the slide, it is very easy and it does not take a lot of time. Next. When it comes to our most at-risk populations, we often found that many of our beneficiaries don't have traditional networks of support. In these cases, we appoint a representative payee or a rep payee for those who need help with decision making. Rep Payee provide a critical lifeline and ensure Social Security funds are used to meet the beneficiaries' basic needs, such as food, shelter, and medical care. Next. Here's another service that is behind the My Social Security account. As you know, Rep Payees must know what the beneficiaries' needs are. They need to notify SSA about any changes that may affect the beneficiary's eligibility. And they also have to complete a yearly accounting form, right? Our representative payee portal lets individual representative payees conduct their own business or manage direct deposit, wage reporting, and annual reporting for their beneficiaries. And it's really easy to switch between conducting business for yourself and conducting business for your beneficiary. It's a matter of just selecting a button on the top of the page. So it's really easy to go from one account to the other. Next. Here's another service that is behind the My Social Security portal. About 3 years ago, we implemented advanced designation. And what that means is that beneficiaries now have the option of identifying up to 3 people who could potentially serve as their representative payee if they ever need help managing their benefits. That means you can now designate in advance an individual you understand cares about your well-being to manage your payments while you're still capable of making that decision. So basically what advanced designation does is that it gives the beneficiary more control over their financial future. Now, this is not on the slide, but I wanted to let you know that we often fund research studies and that these research and studies help us expand our knowledge. They help us shape our intervention and responses. And they also often determine our communications and outreach tactics. And right now, we are looking at how we can, number one, improve data sharing with the State Adult Protective Agency. And also, we're working with the Administrative Conference of the United States to identify opportunities for, but also barriers to sharing information with the state courts. So more to come on that. I thought you will be happy to hear that. Next slide. So we already discussed how to contact and start building a relationship with us. We also discussed how to access some of our online services. We're now going to transition to another important topic, scam awareness. Next. Here are 3 tips to protect yourself from scammers. Number 1 is to understand the threat. Study shows that knowing about a specific scam reduces the likelihood of engagement by 80%, as well as the likelihood of becoming a victim by 40%. So in other words, awareness, just being on the know, is your best shield against scammers. So that is why it's so important to share information with others about the different type of scams that are out there, right? Number 2, exercise caution, right? In general, no government agency or reputable company will call or email you unexpectedly and ask for your personal information or request advance fees for services in the form of wire transfer or gift cards. You know, criminal use this because it is really hard to trace that, right? We also recommend building a habit of verifying the identity of anyone who asks for your personal information over the phone. Number 3, secure your information. Share documents, shred documents that list personal information such as your social security number or bank account information. Avoid opening emails from unknown sources or clicking on suspicious hyperlinks. And check your credit reports for suspicious activities regularly, right? I mean, there's a lot of other things that you can do, but this is just some of the things that you can do to protect yourself from becoming a victim. So next slide. It's important for everyone to know that Social Security will not threaten you, will not press you for personal information, and we will not demand instant payment. Social Security does not accept payments on the form of gift cards, prepaid card, internet currency, or by mailing cash. And as I said earlier, you know, criminals they use these forms of payment because they are hard to trace, right? So it's easier for them to get away with it. Our message is really simple. If you or someone you know receive a letter, a text, a call, or an email that is suspicious, hang up or do not respond. That's it. Just hang up, do not respond, right? We do ask that you report any suspicious fraud to our Office of the Inspector General at oig.ssa.gov. Again, oig.ssa.gov. Next. The best way to protect your social security card is to keep it in a safe place. Usually just knowing your number is enough. We recommend you store your social security card in a secure location and just avoid carrying it with you. Also be careful about sharing your number with others, even if you're asked for it, right? You should ask why your number is needed, how it will be used, and what will happen if you refuse to give your social security number. And you'll be surprised how many people forego that information when you start questioning it. So a lot of times they're like, it's okay, we don't need it. Okay, next slide. If you believe your personal identifiable information or PII has been compromised, we recommend calling the companies where you know fraud occurred, placing a fraud alert and getting your credit reports, and also reporting the identity theft to the FTC at identitytheft.gov. Next. Social Security's role is to correct earnings record. We can assign Social Security numbers, including a new or second Social Security number, provide verifications of SSA's information, conduct outreach, and make referrals, right? So that's our role. Now, I want to make a clarification in reference to a new or second Social Security number. We only issue a new or second Social Security number under very specific conditions. And because so many things are tied to your Social Security number, I mean, I'm talking about medical records, school records, bank accounts, your credit history, past employers, your current employer, everything is connected to your Social Security number, right? Getting a new number may create additional stressors and other issues. So we seldomly issue a new Social Security number. So please do follow our tips for protecting your Social Security number. Next. SSA cannot correct credit reports. We cannot file an identity theft report or act as an advocate. Next. Again, allegations of fraud, waste, and abuse concerning SSA programs and operations should be reported to our Office of the Inspector General at oig.ssa.gov. Next. SSA can refer visitors to credit bureaus and law enforcement agencies to begin the reclamation process. The website and toll-free number listed are direct lines to fraud units who specialize in ID theft. I believe that you're aware of all of these resources, but I didn't want to make any assumptions. And I know that you could access this information later because it will be posted online. So next. Before I pass it over to our next presenter, Cathy, I want to encourage you to follow us on social media, and I want to thank you for listening, and hopefully you found the information I highlighted today to be of value to you and your networks. Thank you.
Thanks, Lydia. That was a lot of really good information and links. And just a reminder, so almost, I would say 99% of what Lydia shared as far as web links are concerned are live links in the PDF handout. So, okay, well now we're gonna hand it on over to Cathy to give us a perspective from on the ground APS.
Good afternoon, everyone. I am Cathy Bahadur. I am the section manager for Georgia's Division of Aging Services Adult Protective Services Program. And I want to thank Crystal for inviting me to present today on the partnership that we have created with our local Social Security Administration Public Affairs Specialists here in Georgia. That partnership started back in 2014 and 2015. We had a influence of unlicensed personal care homes. That's how it started. We had unlicensed personal care homes in the metro Atlanta area, and we had some popping up in our southern part of the state, which is our southeast region area in our Valdosta area. So how our partnership started, once again, is with those unlicensed personal care home. We partnered with our healthcare facility regulations, law enforcement, and even our GBI got involved with these unlicensed personal care homes. We worked together, and we worked together with a secure email partnership. That's foremost, because we're dealing with sensitive information. So you have to make sure that you have a secure email when you're dealing with the Social Security Administration. We are sharing, we are confirming information on abuse, neglect, and exploitation cases, and we're going to get that consent. You know, it's no different from any other case that we will investigate in the Adult Protective Services Program. We get consents for when we speak to the banks, we get consents when we speak to hospitals. So yes, we're going to get that consent when we speak to Social Security Administration as well. And another way that we have partnered together is our public affairs specialist is so good that they will come out and do training and support for our staff. If you call them up and say, hey, I have some new supervisors over here, or I have some new staff members, and we would like for them to know the partnership we have made with you all. Can you come and give in-service a training to staff? They will come and do training and support to the Adult Protective Services Program. Right now, we do not have a MOU or a MOA, but I can tell you just by speaking to the public affairs specialists here in Georgia, they do believe that a MOU will be beneficial. That could speed up the retrieving and the receiving processes that you know, and I know most of you who are on the phone is Adult Protective Services workers probably. Time is of the essence sometimes, and we need some information right away. You know, sometimes we don't know if a person has SSI or SSDI, or if it's on a spouse name or someone else's name, or if a rep payeeship, we might have a person's name, but we don't know the spelling of the name or where that income is going. And sometimes we need to reach out to the Social Security Administration to assist us with that. Words of wisdom I can tell you about. Only thing I can tell you about this is you need to contact your local Social Security office and make that connection with your public affairs specialist. I know some areas might not have one. We're lucky here in Georgia. We have two, but I do know some areas probably do not have a public affairs specialist, and Lydia probably can tell you a little bit more about that than I, but I can tell you the partnership is great here in Georgia. It's to the point now, if we just have a case, like I said before, where we are not sure where that money is going. We might have the name of the what we call the alleged perp, who is the rep payee, but our client might just not know where the bank that money is in. And Social Security can give us some leadway on where we can look to retrieve that information. So that is my presentation today. Please reach out to your public affairs specialists. They can help you more in one way than the other. Thank you.
Thanks, Cathy. So how okay, so you first contacted, it sounded like around this unlicensed personal care home. So did you invite your public affairs specialist to come to MDT meetings? How did you build that relationship?
Well, the relation was built because law enforcement was looking for information too. When we went into these unlicensed personal care homes, we can see information in this home where the money, it might be listed in a booklet where this person might be the rep payee. Well, a rep payee might show up more than once for one consumer. So law enforcement was the lead way on this and reached out to Social Security too. And so we followed behind law enforcement to build this relationship because Social Security wants not to give the money to the person that's alleging or doing the abuse. They want the money in the right hand. So law enforcement, along with adult protective services, we thought sometimes on these type of cases to freeze those accounts. And that's how the relationship really formed. We went in behind law enforcement to follow up on a lot of cases. And once that partnership developed, then we invited them to come and do in-services with our staff.
Great, thank you. That's some really good information there. And then I think you said GVI. What does that stand for? There was an acronym in there that.
Okay, that's GBI,
Oh,
Georgia
GBI.
Bureau Investigation. Yeah, they got involved in these unlicensed personal care homes as well.
Great. Thank you. Thank you so much. Okay, let's go ahead and take it to some questions. And we had some questions come in on the earlier side, which, so this could be actually for both Lydia and Cathy. So who to invite to a statewide team and to understand how they can coordinate protecting older and vulnerable adults. So any opinion on who you would invite to a statewide team? So sounds like a larger group of folks. So I've heard, sounds like law enforcement is an important key. Who from Social Security Administration? Lydia, would that be a regional director or?
Sure, I will recommend starting with the public affairs specialists.
Okay.
Our regional directors and even sometimes the managers are able to participate at this type of event, but ideally it will be the public affairs specialist. And Krista,
Sure.
when you go to our website, we have you could either go to the office locator to find the phone number for the local office. You could look under the regional communications director. The contact information is there. But also we have what we call the Ask for a Speaker, and you could access that from our website. So if you want to invite one of our representatives to attend one of the statewide teams, we can attend. I recommend you use the Ask for a Speaker tab.
Okay, so ask for a speaker via the My Social Security, the SSA.gov.
Right, SSA.gov.
Great. Okay, thank you. And someone actually sent in that sometimes the SSA public affairs specialists have also come to the National Adult Protective Services Association conference, and APS staff were able to connect with them and get contacts there. Thanks, Tanya, for sending that in. That's really helpful. Cathy, did you have any feedback on who to invite to a statewide team from your experience, or?
I will also agree what Lydia has said. I think the public affairs specialist is going to be the go-to person because they're the ones that's actually probably is the person that local APS staff is going to be speaking to. So I would stick with the public affairs specialist as well.
Good point. And then we have more of a general question about just how to work more closely with the Social Security Administration to ensure the protection of assets from exploitation. So that might be, prior to or during, I would imagine, because even though APS would love it to work in the prevention space, mostly it is mostly the intervention space. So any feedback from either Lydia or Cathy on that? Oh, I think you're both on mute.
Okay, I'm sorry, Krista, repeat that question.
Sure. So probably I would assume that this is when exploitation is already happening. So protection of assets. Any recommendation for how to work more closely with the Social Security Administration? Either of you?
Well, I think first of all, you would need to know what type of funding that we're talking about. Is it, SSI, SSDI? And if we're trying to stop the financial exploitation, and we know we have the permanent information, like the client's name, who possibly is the rep payee, where the funding might be going, and if it's really being exploited, yes, the public affairs specialists, if you speak to them and law enforcement is involved, they can have those funds put on a freeze.
Krista, this is Lydia. So if for those listening, if you know of a case of someone who's being exploited, you could certainly start with a public affairs specialist, but then you could also go to our Office of the Inspector General, and the best way to get a hold of them is by going to oig.ssa.gov, and you could submit a report. And to access the report, honestly, the report is right there, and you could access it from their homepage. But the direct link is oig.ssa.gov/report.
Great, thank you. So we have had a couple. Okay. So when looking into personal care homes, can you elaborate on the allegation and the findings and what were the consequences of the homes? So Cathy, I think this is targeted towards you.
Yes, and these, once again, was unlicensed personal care homes, which means they should have not been seen as a place to stay for consumers. So we had a team, this was a team effort that was led by the licensure agency, which is called our Healthcare Facility Regulations, who along with law enforcement, and once law enforcement got involved and saw the degree of it, then, like I said, our local GBI got involved, and they are the one that will contact. We're a part of that team effort when a unlicensed personal care home is being run. We are called to assist with placing consumers out of these homes into a licensed facility. So usually when we're called, law enforcement have already did, along with healthcare facility regulations, some behind the screen type work, and determine that either exploitation or abuse or neglect is going on.
Great, thank you for that. So go ahead and type in any other questions that you may have for Lydia or Cathy. I had, and this ties into something, Lydia, you said about research going on around rep payee. And then Cathy's comment about the public affairs specialist, there's no MOU or MOA right now, but it sounded like there could be one coming down eventually, or it would be better. I guess, is there a timeline, Lydia, for when the research in any kind of analysis and action around rep payees is going to be released by the Social Security Administration?
I don't have that information, unfortunately, but I do know that our senior executive are in communication with, I believe, with the National Adult State Adult Protective Agency, and there's a lot of conversations going on that I'm not privy to.
Sure,
So
sure.
no, unfortunately, I do not have that information.
Sure. No problem. I think it's exciting to know that this is all going on at those higher levels. So I appreciate that. And then, Cathy, around an MOU, any sense of what that would look like, or would that just be something that you would do at the state level between that local office and your agency, or?
I would imagine, yes, Krista, that it will be something that the local Social Security Administration would do with the Division of Aging Services. But, you know, if we're looking at the broad perspective of this, of having it nationwide, it might be something that, you know, I don't know who in the Social Security Administration would want to put this on for all adult protective services nationwide.
Right. And I think that gets to those higher levels at Social Security Administration and ACL, and maybe piggybacking on some of the research that Social Security Administration is doing around that. So, okay, just trying to kind of drill down a little bit on this, because I know that I know that both sides have their own confidentiality and information sharing challenges. So just curious. Okay, so last chance to get any questions in before we let these two busy ladies go back to their what they were doing before. So let's go ahead and go into the next slide. I actually want to thank our attendees today for this, because this was truly born out of coming directly from the field. So this was on the formula grant listserv around some of the challenges and some of the best practices, and we reached out to the Social Security Administration, and this really came from all of your information to us. So that was really helpful. I want to thank Cathy. I want to thank Lydia. They both have put in an enormous amount of time and thought into being with us today, and thank you for all that really helpful information. I want to thank Andy Capehart for running the slides and being behind the scenes. Thank you again, participants. And okay, we have one more question. When you can designate 3 possible rep payees, could one of them become a successor should one be found to have exploited in a quicker manner than replacing a rep payee? That's a very good question, Patricia. Lydia, does that make sense to you? So if you can designate 3, could one of them become a successor quicker if the primary is found to be exploiting the person? Oh, sounds like you're on mute.
I think I need a little bit more info, Cathy.
So you can there was a slide, and I'm forgetting what slide it was, but there was new within the last 3 years, you can have more than one person be listed as a rep payee. Was that, maybe I misinterpreted the slide.
Advanced designation. Okay, yes.
Yes. So if the primary person who is the rep payee is found to be exploiting the person, could the second or third identified person become the rep payee instead of having to replace them? Does that make sense?
Yes.
Okay.
So, but let me just clarify. While you can designate someone to be your representative pay in advance, that doesn't mean that we're going to automatically just appoint them, right? if in the event that a representative payee is needed, they will have to, first of all, apply to become your representative payee. So that means that we will probably be contacting them and asking them if they are interested in becoming a representative payee. And once they complete the application, we have to appoint them to become that person's representative payee. So the beneficiary can designate a number of people, right? But it doesn't mean that we're gonna select in a specific order or that they will automatically become that beneficiary's representative payee. We have to go through the steps, right? First of all, we need to determine that the beneficiary is incapable of managing his or her benefits. Then with the designee has to apply to become a representative payee. And lastly, we have to appoint them. Okay?
Okay, so sounds like not quicker necessarily. I think
well, what advanced designation does really is that it gives a lot more control to the beneficiary.
Gotcha.
So they can make that decision when they're still capable of making that decision. And they may not never need a representative payee. It's more like precautionary, you know?
Right. Totally understand. Yeah, that makes sense. Good question though, Patricia. Good clarification for sure. So, all right. Well, thank you so much. We hope to see you for the next APS TARC Formula Grant webinar. It's going to be on strategies for retention and recruitment and APS program panel discussion. That's on February 9th, and we'll be sending a registration reminder out early next week through the Formula Grant listserv in case you have not registered for that yet. We would love to see you there. And with that, thank you very much, Cathy and Lydia and everyone. And we will let you go a few minutes early back to your day. Thanks very much.
Thank you.